Hey guys, Richard here. In this post we were talking about a treatment plan, and I really wanted to stress that having that treatment plan is pretty important. It's going to allow you to basically look and see the path that you're going to follow with your treatment. And you can make adjustments along the way as you find that maybe this is working or this needs to be changed a little bit. But you can look at it and say, okay, so this is not working. What's the next step? Okay, well, the next step in my treatment plan is to try this or to try that. So maybe your first step is medications, and your next step is to follow up and do do some sessions with a therapist or a counselor once the medications have had time to kick in and bring you to more of a stable level. What might happen is that you find that after 4 weeks to 3 months time period, that the medications aren't working for you. So that step in your treatment plan is not going to be used yet, but it's still there. So now your first step with the medications, it's not working. So the branch off to that is, okay, we try a different medication. And medications can be tricky because, for certain people, they affect people different ways. Some people it'll work, some people it won't. The next step also might be, okay, I'm on medications trying to get stable, but I also need to do a little bit of work on what's called cognitive behavioral therapy, or CBT. So you go out and you buy the book Mind Over Mood, which is what I recommend. It's a great book on CBT. So while your medications are taking some time to try and kick in and help you out a little bit, you're also looking at the CBT side of it and taking a look at changing the way that you think, the negative thoughts that you have, and turning those thoughts around. Having a step-by-step treatment plan, I think, is important, and work it out with a doctor or a counselor that you're working on, and say, let's create 5 steps and branch off, and what I need to do at each step. What's my action that I have to take for each step. That's just from my experience of living with the depression. The mistakes that I made along the way were that we never really had a treatment plan. The treatment plan was always keep trying new medication until we find something that worked. And people would throw advice at me, but I was at a point that I didn't care, so I would never take the advice. I think that maybe if there had been a treatment plan in place, then it would have given me a better feeling that, okay, this is what's going to happen. This is the long or short-term goals, and these are the things that I need to work on while this is trying to work. So while the medications are trying to work, I'm also doing this. While I'm seeing a counselor, I'm also doing this and this. If the treatment is then to start doing exercise every day or every other day for at least 20 minutes. So, I need to start doing that, and I need to incorporate that. And even if I don't feel like it, I need to force myself, and over time it'll become a routine. So, just wanted to give a brief, overview of the treatment, and just stress that it is important. Thank you for listening.